GI pathology, liver tumors. All right, so for the liver tumors, we're just going to take it one by one. It's going to be relatively quick and straightforward. First, we have hepatic hemangioma. This is the most common benign liver tumor. It usually is like a venous malformation. It occurs at the age of 30 to 50 years old, and a biopsy is contraindicated, which you'll see for a lot of these liver tumors because you have an increased risk of hemorrhage. If you go to biopsy it, it's most likely going to be a venous malformation, and you're going to nick a vessel, and it's going to cause some type of bleeding. For the next one, it's focal nodular hyperplasia. What they want you to know about this is that it's going to be in females aged 35 to 50, but the highest yield thing is that it's going to be marked by central stellate scar. So if you see a central stellate scar, it's usually going to be a focal nodular hyperplasia, okay? That's something they want you to know. Next is hepatic adenoma. If you see a very young woman, it's probably going to be hepatic adenoma, and it's often related to oral contraceptive or anabolic steroid usage. So a young woman who's on OCPs, they probably will have hepatic adenoma. Now, once again, this is an increased risk for spontaneous rupture. Okay, so they have an increased risk for rupture in these patients, which could present with abdominal pain and shock in a hepatic adenoma. Next is hepatocellular carcinoma. These are patients that have an increased risk, most commonly due to the fact that they have previous liver disease, okay? It's the most common primary malignant liver tumor in adults, so it's the most common primary malignant liver tumor, and it's associated with Hep B virus, okay? Hep B virus. Now, all other causes of cirrhosis can lead to hepatocellular carcinoma, like alcoholism, non-alcoholic fatty liver disease, autoimmune disease, hemochromatosis, Wilson's disease, alpha-1 antitrypsin deficiency, carcinogen, specifically aflatoxin, is very high yield to know from Aspergillus. Aflatoxin is like found in corn, and it's found in hot environments and other foods, okay? So if you see that, they're talking about hepatocellular carcinoma. What they also want you to know is that AFP is the primary tumor marker for hepatocellular carcinoma. So write down alpha-fetoprotein is the number one tumor marker for hepatocellular carcinoma. You should write that down, all right? Next is going to be hepatic angiosarcoma. This is exposure to arsenic or vinyl chloride. So if you ever see a patient that's been exposed to these weird elements, it's probably going to be hepatic angiosarcoma. Lastly is metastasis. So Mets to the liver is the most common malignant liver tumors overall, right? And what you're probably going to be seeing, the primary sources are usually going to come from the GI tract. So you have GI cancer that Mets usually to the liver, but you can also have metastasis from the breast and from the lungs. Now, metastases are rarely ever solitary. So if you see multiple spots on the liver, then you could start thinking about metastasis, okay, from specifically the GI, right? Because from GI, it's going to drain via the portal system and hit the liver, okay? So that's how the cancer can get there. So those are the liver tumors. Those are kind of the high yield things to keep in mind. If you have any questions, once again, be sure to reach out.